says guns don't kill people.
Looks like she got jumped in her apartment by a couple of gangbangers.
Drug related. On three. 1, 2, 3.
Stat page down getting.
Hey, Thor, you need a hand?
Hey.
Dr. Kellerman. Dr. Kellerman.
Hey, Kay, she's asking for you.
Oh, Melora.
Can you see where it's bleeding?
It's the backside of the heart, but every time I lift it, she drops her pressure clamp.
You hear there was bambalacha in her apartment.
Bumble what?
Bail, boom, bobo, marijuana.
Who told you that?
Cop at the desk. Some of the local dealers didn't like the competition. Sent these kids in to lift her stash. She came home at the wrong time.
Explains a lot.
Yeah, like what?
Like how she was able to drive a Mercedes M-Class while working full-time as a volunteer.
Finally caught up to her.
All right, enough already, okay, folks? All I'm trying to do here is fix a hole in this woman's heart, and she's family, so if you gotta talk, take it outside, please. Turn the music up, would you, please? Thank you.
Here it is. Today's visitor sign-in sheet. Room 1267 had...
No one. No friends. No relatives.
Huh. Apparently not.
Huh. What do you mean by huh?
Did I say huh?
Yes, if you were surprised that it was left blank.
I'm not surprised.
Did Mr. Orloff, in fact, have a visitor who perhaps did not sign in?
I don't think so.
Then why did you say huh?
Did I say huh? I didn't hear it.
Did you step away from the desk at any time?
I step away from the desk lots of times. I'm a nurse.
So am I. Do you recall the approximate times you stepped away?
No.
No what? No, you can't recall, or no, you won't recall?
No, I can't, and no, I won't, because I've got things to do. I'm telling you, if the sign-in sheet says Mr. Orloff didn't have any visitors today, he had no visitors today.
Huh.
You know, her dad was a patient of mine.
Melora's?
Yeah. It's about 5, 6 years ago. He had esophageal cancer, did a resection, aggressive chemo, but in the end...
Awful way to go.
So about a year ago, Melora approaches me. And in the meantime, she got, hooked up with all these cannabis groups. Said the worst part about what happened to her dad was watching him waste away. No appetite, all the nausea, just shriveling up. So she wanted to help people, wanted to help other families. So I put the word up. I let certain oncologists know that if their patients so desire, that I could get them what they wanted.
So this is your fault? If you hadn't helped her, she would have found someone else who would have. I hate to break it to you, my friend, but you are not responsible for everything that happens in the world. You have control over your own actions, what happens in your operating room, and your kid to some extent. Everything else is in someone else's hands. Sucks being mortal.
Yeah.
Dr. Joyner.
Ah, Mr. Donga, I have good news for you. Mr. Wallace, the arrhythmia, is doing so well, I am sending him home.
That's excellent news. Seems like we're having a record number of discharges today. Looks like my weekly one-on-ones with you doctors are starting to pay off.
Unfortunately, I can't take credit for strong-arming the cable guy. I never got a hold of him. This morning, for some unknown reason, the TVs just worked.
We'll take it.
Yeah.
What are you two looking so happy about? Do you know if Mr. Plotkin went for tests?
No, he should be in his room.
Hey, Jess. Hey, I'm glad you decided to come in.
I was coughing all night. I came to get some of those antibiotics.
Right. Well, Dr. Joyner's going to give you an exam.
Oh, no, remember you were just gonna give me some pills and then I was gonna be good to go.
Yeah, well, I'm actually just an intern, and I can't prescribe on my own. But Dr. Joyner's great, and I think that you'll feel better if you have a full exam.
Well, I gotta record the first of the year.
Right. I know.
So far, Mr. Orloff's not responding to the immunotherapy or the chemo.
Maybe give it a little more time.
We have to. It's his best shot.
It's his only shot.
He's still out. Let him sleep.
And who are you?
Name's Joe.
Joe. It's Dr. Dalgetty's patient, Joe.
Yeah. Dr. Dalgetty is managing my care.
Apparently not very well. Joe, we need you to go back to your bed, okay?
I know, but he needed comfort.
All right, but we're gonna take it from here. Let's go back to your room. Come on. All right? Oh, he's burning up.
Nurse.
Hey, Joe. Hey, buddy.
Deep breath. Okay, give me one more. Real deep.
This cough is a pain in the ass.
Okay. How long have you had it? The cough.
6 weeks on and off.
You been hoarse?
Show me a singer who has it.
Well, your lungs sound pretty clear.
Okay, so I'm good then, right? I can go?
Well, it just means that the cough is coming from somewhere else. I think we need to get an x-ray.
Is something wrong?
An x-ray is just routine. Nothing to be afraid of.
How's our girl, huh? She's still bleeding.
Yeah, since we brought her up.
Well, why didn't you page me? How many units has she had?
4 bags. You think we missed something in her chest?
I doubt it. What's her platelet count?
It's about 30 grand.
Give her some more. Check her coax.
Got it.
Anything changes, page me.
Okay.
This is what I was afraid of.
What?
There's more fluid around the implants.
But they're okay, right? The antibiotics are still working?
Well, I'm going to take a culture and we'll see. Deep breath. You'll feel a little stick. How many patients did you visit last night?
The ones who needed me?
Look, Joe, you're going to have to meet me halfway here. I can't have you wandering around the halls, putting yourself and other patients at risk.
I'm sorry, but they were in pain, and I thought it might help to have a hand to hold.
Help yourself. Stay in bed.
I'm telling you the truth from my mouth to his ears. I feel fine.
What's going on?
A miracle. I can shake your hand. There's no pain.
Well, that's great.
John says his cancer is gone.
Don't look at me like that. Listen, Kellerman, you and the Sourpuss can think what you want. Last night, that angel visited me, and this morning, pain is gone.
And all I'm asking, Mr. Orloff, is that you stick around long enough to have a scan and see what's going on.
I don't need a scan to know what's going on. What's going on is I'm cured and I'm going to start living. That's what's going on.
Listen, John, let Dr. Burton do the scan, okay? You're obviously having a really great day. The treatment, my friend, is working very well.
Come on.
Let's see what's going on. This way we know how to proceed from here.
I am proceeding out of this hospital and straight to dinner. I'm hungry. You know how long it's been since I've been hungry?
Do the scan, I'll buy dinner.
I'm talking pricey here, Kellerman. I'm talking, you know, 5-star restaurant, the works.
Yeah, it's cool.
Can I bring a date?
You got a date?
You're paying, I'll get a date.
Done.
All right, come on, let's get this over with. Come on. Slowpoke.
Thank you.
It's a miracle.
It's pretty miraculous, whatever it is.
It's called medicine.
Stage 4 small cell carcinoma. Now, this film was taken 3 weeks ago upon admission, and this we just took.
The tumors are gone.
Are you sure this is Orlov?
I ran the second series myself.
It's got to be the chemo.
It's nothing short of miraculous.
Will people please stop using that word?
I don't believe it. They don't believe it. They think it's God knows what. What? Here, ask him. Go ahead. Tell him. Go ahead. Tell him. What? Huh? Look at that.
No, it is not a joke. There is a patient in room 306 who is healing people. Yeah, I saw the CT scan. And a bacterial infection down on 3 just cleared itself up overnight. A dislocated shoulder popped itself back in, and 2 preterm labors down in L&D just stopped contracting. Apparently he kind of lays on hands. Well, I wanna talk to him about maybe doing some spots for us. No, I think they could be tasteful. Like a Sutro medical heavenly care. You know, and then we'd kind of go in on the wings. No, I don't think they flap, no.
Jess, you want to come in?
Jess, you have a mass in your upper right chest. It's wrapped around the nerve leading to your vocal cords. That's what's causing the cough and your hoarseness.
What do you mean, a mass?
It could be a malignancy, but we won't know for sure until we go in and do a biopsy.
Well, she said it was an infection, a bronchial infection.
Yeah, well, the important thing now is that we caught it, and that it's operable, and with an aggressive approach, surgery, radiation, chemo, your prognosis is good.
So what you're saying is I'll be cured, right? Like it'll be cured?
Yeah, but there is a good chance that we'll have to go in and remove that nerve. Most of our patients recover the ability to speak normally.
Hold on, I have to be able to sing. I'm gonna be able to sing, right?
If we remove the nerve, probably not.
You know what? I gotta be somewhere.
Jess, hold on a second. Jess, listen, I know that this is a lot for you to handle.
You don't know anything about me, Matt.
Look, this kind of cancer has a really high rate of recovery, okay? It's not a death sentence.
To me, not being able to sing is a death sentence.
You don't know that that's what's gonna happen.
She just told me if I get a surgery, I'm not gonna be able to sing again.
Listen,
Don't even waste your breath.
How's she doing?
Not good. She won't stop bleeding.
Well, the clotting factors are washed out.
Tell me about it. I'm replacing them, but can't catch up. What's up?